welcome to our video on human bites. Let's get started. Here's a list of the topics that we'll be discussing for human bites. So let's start with the clinical presentations. Human bites are typically due to aggressive acts such as assault or abuse, but they can also be due to self-inflicted harm. Now, due to the shape of human teeth, a bite is more likely to cause a crush injury than an actual puncture wound. Another specific type of bite injury that you should be aware of is known as a clenched fist injury. These injuries occur when the patient punches the mouth of another person with a closed fist. The teeth of the victim will make contact with the patient's metacarpophalangeal joints, the MCPs, leading to small bite wounds over these joints. Now, this image shows a clenched fist injury in the process of healing. Now, pay special attention to the location of the wound. Clenched fist injuries will typically be present over the MCP joints, as you can see here. Now, if you consider this location, it's kind of sensitive over a joint, it's easy to see why a clenched fist injury like this can require a surgery consult, or especially a hand surgery consult. Now, this injury is in close proximity to many other joints and their tendons, and so it can actually lead to an infection of the deep spaces of the hand. So be thinking in the back of your mind, do you need to be consulting hand surgery? Now, the main complication associated with human bites is the same as in animal bites, infection. Now, infections from human bites are typically a mixture of aerobic organisms and anaerobic organisms, and that's from the oral flora of the person who caused the bite. Now, the most common pathogens associated with human bites are Staphylococcus and Streptococcus, and rarely a human bite may also transmit a virus, but really you're just thinking staph and strep bacteria. Now, complications of infections associated with human bites include cellulitis, septic arthritis, which makes sense because if you were bitten on a joint or you punched somebody and you got their teeth marks in your MCP joint, and septic arthritis makes sense, and also osteomyelitis. There may also be associated fractures or tendon injuries, especially if the bite injuries are on the hands. Now, the first step to evaluate a human bite is to perform a good history and a physical exam. Now, you should closely examine the bite wound and assess the location, the depth, and the nature of the bite. In addition, if the bite wound occurs in a child, you should also perform a thorough history to examine for potential child abuse. Now, if your physical exam reveals a wound that appears infected, you should order a CBC and both aerobic and anaerobic wound cultures. And if there's concern for a fracture or infection close to a joint space, such as a clenched fist injury, then an X-ray of the affected area should also be ordered. After performing a thorough physical exam, basic wound care should be performed to stop the bleeding. In addition, the wound should be cleaned with soap and water or with irrigation with normal saline. The wound should then be debrided to remove any foreign material or debris. After ensuring that the foreign materials are removed, the wound should be left open to heal. This is called healing by secondary intention. And it actually makes sense that you wouldn't want to suture it closed because there's such a high risk of infection in these patients. And suturing and closing the wound actually increases the risk of infection. So again, clean it out and then leave it open. Now, requirements for antibiotic treatment for human bites are really similar to those for animal bites. The antibiotics should be prescribed if the wound is infected or if the bite is located on the hands, face, genitals, or in close proximity to joints or ligaments, and if the bite wound leads to a crush injury. In other words, if at the time one acquired the bite wound, they also obtained a crush injury to that location, you're going to want to give antibiotics. And the first line treatment for these human bites is amoxicillin clavulanate. For human bites, you'll also need to determine if the patient needs tetanus prophylaxis. And so if you're thinking about this, you can review our animal bites lecture, which has that chart. But just keep in the back of your mind, do we need to be thinking about a tetanus shot? You may also consider testing for HIV. But honestly, the likelihood of transmission of viruses via a bite wound is so small, especially if there's not exposure to a lot of blood. So in other words, the person causing the bite, are they also bleeding? So as we mentioned before, viruses just are not likely to be transmitted through a human bite, and that includes HIV. Now, for clenched fist injuries, you're also going to consider consulting hand surgery because of that high likelihood of infection or damage to the joint space. So right there, it's all about location. So the MCP joint, think hand surgery. Here's a table that summarizes bites from humans. And for ease of review, this table is also included in the other videos which discuss the other types of bites. So you can reference this same table after you review those videos. So let's wrap up with a question. What are the considerations when deciding to treat human bites with antibiotics? And what is the first line antibiotic prescribed? Now, it's recommended to treat human bites with antibiotics if the wound is infected, and if the bite is on the hands, face, genitals, near joints, or ligaments, then you're also going to want to give antibiotics. And lastly, if there's a crush injury associated, then you're also going to want to give antibiotics. Now, the antibiotic of choice when treating human bites is, once again, amoxicillin clavulanate. And that concludes this section.